Welcome to the 41st sitting of the Tobago House of Assemblies 2013 to 2017 session, which took place at the Assembly Chamber at Gillingham Street.
Thank you, Mr. Presiding Officer. I stand to move a motion standing in my name, and I read, whereas the Aedes aegypti mosquito is a threat to the Caribbean region, as it is the main vector that transmits the viruses that cause dengue, chikungunya, and Zika. And whereas the Caribbean Public Health Agency, CARPHA, has supported its member state by enhancing regional surveillance and the agency's capacity for vector-borne diseases testing by monitoring regional and global developments, partnering with regional and international stakeholders, and providing updates for agencies of health and other key stakeholders. And whereas the basic approach to vector-borne diseases is by controlling the proliferation of the vector, in this case, the Aedes aegypti mosquito. And whereas for years, the Tobago House of Assembly has implemented numerous strategies which include controlling and monitoring of the vector, building public awareness for prevention, early detection, and support for victims, be it resolved that this House support the strong measures and strategies instituted by the Assembly to control the mosquito population on the island, and be it further resolved that this robust integrative management approach be sustained and intensified with the collaboration of all divisions of the Tobago House of Assembly and other government agencies, and be it further resolved that while the Tobago House of Assembly continues to fulfill its mandate in response to this threat, that this House urge all residents to adopt appropriate measures to control the mosquito population, to prevent mosquito bites in at-risk individuals, especially pregnant women, and to collaborate in minimizing the potential dangers associated with this threat. Mr. Presiding Officer, flight range studies suggest that most female Aedes aegypti mosquito may spend their lifetime in or around the houses where they emerge as adults, and they usually fly an average of 400 meters. So this means that people, rather than mosquitoes, rapidly move the virus within and between communities and places. Mr. Presiding Officer, the Minister of Health has stated that Trinidad and Tobago has reported its first case of the Zika virus. And while there is no confirmed case of Zika in Tobago, we must know that this may just be a matter of time. Mr. Presiding Officer, this is a new disease, and it is not clear just how it will manifest in our population here in Tobago. According to WHO, the real problem with the Zika virus is who it affects and what consequential damage would occur as a result of somebody becoming infected with it. And so from the perspective of the health of the population, the most important people who will stand the consequential problem are the pregnant patients. In Tobago, we have an annual birth rate of approximately 1,000 to patients delivering live babies. Mr. Presiding Officer, at this moment, we have approximately 1,000 pregnant patients in Tobago who will be extremely worried now that the Zika virus is in Trinidad. Mr. Presiding Officer, as the Caribbean public health sector ramps up its response to the Zika virus in the region, we are strongly advising the adoption of personal protective measures to avoid mosquito bites and the reduction of mosquito breeding grounds here in Tobago. Mr. Presiding Officer, we have been meeting with the Tobago Public Health Emergency Response Team to reinforce preventive actions and response. And I must note that this started since January 2014.
As a division, we have responsibility for a number of public buildings. And the division in recent days would have taken note of that, and we would have had our health and safety people going out to inspect the different buildings of the division, different buildings that the division utilizes around the island, ensuring that corrective measures are being put in place where there are issues with any of these sites. And of course, the division is seeking to provide as much information as possible to its staff and the members of the public that interact with us in terms of the Aedes aegypti control. Of course, the Secretary would have noted, and we all have to take on board the fact that what is required is really an effort from all of us. All of us have a role to play, whether that role that we play as individuals in ensuring that what takes place at our homes, at our residence and so on, that we don't create a breeding ground for the Aedes aegypti. But it also creates situations where we can, as people, have greater collaboration, because it's not just each individual by themselves. We mentioned the issue of empty lots. It means that those of us who own properties that we have not built on or we're not ready to build on and so on, we need to take and give some consideration for the people who live there, that we keep that property in a state where it doesn't impact upon, it doesn't create this breeding situation for the mosquito. And this cannot be just about the fact that Zika is the current disease of the day, if you want to call it that, because we observe that in these times, for the last many years, almost every year, some virus or the other takes center stage, and everybody becomes very concerned about. But as I said, it has to be an approach that is not just limited to this, but it's an approach that we have to practice throughout. Because of course, we in the Tobago House of Assembly has been living with the mantra of clean, green, safe and serene for a very long time. And you can't ask to be more clean or to be more green in terms of the approach that we are adopting to manage the Aedes aegypti mosquito. As I said, my division is squarely on board. We have made ourselves available to collaborate with the Division of Health and Social Services. We are working in our own way in-house to be part of the program, that we have an environment that is not conducive to the breeding of the Aedes aegypti. And in that way, as I said, this is a motion that any reasonable person would want to support. We have situations, for example, where in terms of we're now in the dry season, which may be one of the driest of dry seasons. And of course, I know many homeowners, householders will be concerned now about storage of water. But of course, in so doing, we have to be very careful in this particular situation, because we know that, depending on how the water is stored and so on, it can again create opportunities for breeding of the mosquito. And hence we are in the division, right now we are pursuing an initiative with the Ministry of Public Utilities in Trinidad through their Utilities Assistance Program, where either through the ministry or as part of the Assembly's program, we can provide water tanks to needy households so that people would not have to store waters in some of the kind of situations that people do. And as I talk about water, while I'm on my feet, Mr. Presiding Officer, I would want to take the opportunity to just give a reminder to the population that we are now in trying circumstances where our water supply is concerned. It is very likely to continue to be so for the months ahead, likely to have a very challenging dry season. And I want to take every opportunity that I can to ask the citizens of Tobago that we all in our own way seek to conserve water where possible. Because, as I said, we know the challenges are there. We have a situation where the main source serving Southwest Tobago is operating at about 15% capacity. That is a very serious situation. And WASA are making efforts to be able to supplement the situation, but some of those efforts are going to take a bit of time to happen. And therefore, each of us, in whatever possible way we can, we have to conserve water. This is one situation I think we've been one of the most challenging situations ever facing us where water availability is concerned. And we in the division want to take every opportunity to warn the population, let us conserve water, let us in our own way see how best we can optimize the use of the little that we have. So, Mr. Presiding Officer, to come back to the motion, it is one that I am very pleased to support, because in the circumstances, the approach to treating with the Aedes aegypti mosquito is really an approach that we haven't taken treating with other situations like that, including some of our other problems that we have, whether we talk about rodents and things like that. It is really about us as a society seeking to maintain basic minimum standards.
But diseases are not only limited to the human body. In fact, the word itself, dis-ease, will tell you that any situation that causes a dysfunction to the order of the day of what society considers natural and normal is disease. And therefore, these days, we can say we have a lot of diseases around coming at us. It's Zika, chikungunya, dengue, H1N1, HIV/AIDS, all of them. We have diseases of the economy called recession. And from time to time, we even have diseases of politics. And as I say that, let me take the opportunity to wish our brothers and sisters in Jamaica a safe election day today. And may God provide for the leader who is supposed to be in place to emerge in a safe way. I know that they have had some violence, but I wish them all the best. But the formula for dealing with diseases is the same in every case. Prevention is better than cure. In the case of cures, it becomes a survival of the fittest. Either the host survives or the disease dies with the host. The diseases in general can be debilitating, and a lot of resources can be exhausted in either bringing relief to the affected or developing a cure. We must recognize it is more costly to families involved, the communities, and even the health sector that becomes overwhelmed from the amount of human resource and financial resources to continue the fight for lives when indeed we are taking it from a curative point of view. The positive side, though, is that diseases, if and when severe enough, lead to innovation and collaboration in finding solutions. And that is why in the medical fraternity, we often say prevention is better than cure. It is proven that in most cases, if not all, preventative measures are far less costly to assist them and therefore should be the first line of attack. I must therefore reiterate my commendation for the Division of Health and Social Services. I am therefore urging all communities to get on board in the cleanup of their communities, clear standing water and old debris, and I look forward to the repellent stations being used as part of the festival. Mr. Presiding Officer, in the old days, we swept our yards. Even if they were dirty yards, we swept them as a symbol of our commitment to good hygiene and cleanliness. Let us reflect and continue to act in accordance with our mantra to being clean, green, safe, and serene. In closing, I wish to go back to a conversation on Zika. The Executive Council, many times we take hard decisions week after week. And like the health sector, sometimes we don't hear about, the good decisions we take, but we hear about the perceived poor decision that we may have made. But whilst there are many theories out there about Zika and the malformations in during pregnancy that end up in microcephaly areas, and that is seen in the area in Brazil, people question, why was Zika around for so many years in Africa and they never saw any of these outcomes? And one of the theories, in fact, one of the theories put forward is the fact that bioengineered approaches have been taken to getting rid of the Aedes aegypti mosquito. And that perhaps has made the mosquito a greater threat to pregnant women. And while the jury continues to deliberate on that issue, I wish to commend my colleagues for taking a decision over a year ago not to accept a proposal that was being considered in Trinidad for use of bioengineering techniques to eradicate mosquitoes. And I really want to commend my colleagues for the research that we continue to do in making the decisions at that table week after week. Give yourselves a little pound on the table, colleagues. Mr. Presiding Officer, sometimes the basic strategies of cleanliness, good hygiene, moderation, and care go a longer way in preventing us from the ills that are looming. Let us again commend the Assemblyman for Blackrock Wim Spring Garden and her Division of Health and Social Services, her staff, all other divisions, all other residents across this island who have come on board to collaborate in this fight, and thank them for all that they are doing as part of this integrated approach to Don't Get Bite.
It's incumbent on all of us to acknowledge that this virus is a serious one, and we all have the responsibility, Mr. Presiding Officer, to bring the awareness to the populace of Tobago. So as members of the Tobago House of Assembly, we are doing our part, and we are responsible for ensuring that the information gets out there, Mr. Presiding Officer. But what is incumbent upon the populace, all Tobagonians, Mr. Presiding Officer, is to also do their part. Because we will disseminate the information, we will do what is necessary to ensure that preventative measures are taking place. But homeowners, business operators, members of the community, Tobagonians as a whole, Mr. Presiding Officer, have a responsibility to do their part as well to prevent the spreading of this particular virus and the mosquito breeding, as a matter of fact. So as we work in collaboration and in unison with the Division of Health and Social Services to combat the Aedes aegypti mosquito, we continue to work tirelessly to eradicate the breeding spaces. At present, we are disseminating information to all our staff in the Division of Settlements and Labor and our clients to ensure that they are fully aware as to the preventative measures to safeguard their families and their communities and to treat with preventing of the breeding of the mosquito. Mr. Presiding Officer, cleaning of drains and landscaping of green spaces will continue from a divisional standpoint. However, Mr. Presiding Officer, as I said before, it is the responsibility of homeowners to ensure that they take the necessary action to avoid their homes becoming breeding spaces for mosquitoes. And there are a number of measures that can be employed. For instance, Tobago has a vast expanse of swamplands that is part of our wetlands ecological system. And as such, we need to ensure that those ecological causeways are cleaned regularly. And I'm quite certain my colleague, Secretary with Responsibility for the Environment, Secretary Adams, will take cognizance of that and has been doing that. The natural ecosystems, Mr. Presiding Officer, once maintained, will be able to assist with controlling the insect population. However, with the introduction of foreign materials such as trash, toxic waste, and household waste, sometimes can affect these ecological systems from functioning their natural potential. And therefore, I'm certain that once these causeways are cleaned and cleared, they will do their part as well. Old and abandoned vehicles mentioned by my colleague, Secretary Melville, need to be taken out of communities, Mr. Presiding Officer. And the mover of the motion would have spoken to that as well. The division is working tirelessly in the Division of Health and Social Services to treat with derelict vehicles in communities, and we are partnering with the division in that regard. Potholes and clogged drains in areas not frequented by vehicular traffic is another simple but important aspect that we need to look at, Mr. Presiding Officer. Mr. Presiding Officer, the frequent removing of garbage and clearing of illegal dumping sites is also critical in the fight to the proliferation of breeding sites and mosquitoes such as the Aedes aegypti mosquito. Burning of bushes and clearing of the areas can also aid in smoking out the breeding sites of mosquitoes. I am not advocating, Mr. Presiding Officer, in any way that individuals start bushfires. I am informed that the fire department gives individuals permission to start and manage small fires. So in that light, anyone who wants to do such can seek the relevant permission from the fire department. Mr. Presiding Officer, creating and building the awareness is one aspect in combating the Zika virus. But we as a people, all Tobagonians, must take responsibility for themselves, their families, and their respective living spaces. So, Mr. Presiding Officer, if we want to avoid getting bitten, just as the mantra says, and the tagline for the campaign, don't get bite, I humbly suggest that we all do our part. Because we cannot do this on our own, Mr. Presiding Officer, but with the collaboration of all homeowners and business owners, we can indefinitely, undoubtedly, do it together.
We are giving out free nets at all of our antenatal clinics. Of course, nothing is free. The Assembly is paying for it. And that is a significant move to do all that we can to protect those populations. Mr. Presiding Officer, we continue to give this House the assurance that no stone is being left unturned to protect all of our people against Zika and other vector-borne diseases. We urge all of our citizens to follow the WHO protocols to treat with Zika. Mr. Presiding Officer, the integrated management system has different components. The ongoing components, which are health education and social communications, we are doing that. However, we need more funding to ramp up our media presence, and this is significant. We have to be at the face of our people all the time, to be there with them, to inform them, and to remind them. Mr. Presiding Officer, we have ramped up our surveillance. Our integrated vector management is ongoing. This has been an ongoing exercise since 2014. And so this vigilance has decreased our index, that is the number of mosquitoes on the island, to under the international standard of 5 to 2.5 in some instances, 2.8 in other cases, and the highest in the Scarborough and environs area with an index of about 4.3. And here I must commend the administrator and the public health sector, members of staff in the Division of Health and Social Services, as well, including CPEP, this organization that has helped tremendously with the public health sector to reduce the index of mosquitoes on the island. Mr. Presiding Officer, I must say that many people are beginning to heed the warnings, and they are turning over their plant sources and they are cleaning. Nonetheless, I am seeking support of this House for the Assembly to join the central government to currently review the Regulation 27 as amended by the Law Revision Act, Chapter 303 of the Public Health Ordinance, Chapter 12, Number 4.
Honorable members, the question is, whereas the Aedes aegypti mosquito is a threat to the Caribbean region, as it is the main vector that transmits the viruses that cause dengue, chikungunya, and Zika, and whereas the Caribbean Public Health Agency, CARPHA, has supported its member states by enhancing regional surveillance and the agency's capacity for vector-borne diseases testing, by monitoring regional and global developments, partnering with regional and international stakeholders, and providing updates for agencies of health and other key stakeholders. And whereas the basic approach to vector-borne diseases is by controlling the proliferation of the vector, in this case the Aedes aegypti mosquito, and whereas for years the Tobago House of Assembly has implemented numerous strategies which include controlling and monitoring of the vector, building public awareness for prevention, early detection, and support for victims, be it resolved that this House support the strong measures and strategies instituted by the Assembly to control the mosquito population on the island, and be it further resolved that this robust integrative management approach be sustained and intensified with the collaboration of all divisions of the Tobago House of Assembly and other government agencies, and be it further resolved that while the Tobago House of Assembly continues to fulfill its mandate in response to this threat, that this House urge all residents to adopt appropriate measures to control the mosquito population, to prevent mosquito bites in at-risk individuals, especially pregnant women, and to collaborate in minimizing the potential dangers associated with this threat. Those in favor say aye. Aye. Those against say nay. The ayes have it. The motion is therefore carried.
Thank you for joining us for the 41st Tobago House of Assembly's 2013 to 2017 plenary session.